Hello, hello, everyone. I am so excited today because we're going to talk about some of the common challenges most of my patients face, including myself. I work with a lot of very successful, very kick ass women, and some of the struggles are very common, which is anxiety, feeling the constant stress of getting everything done. And that sort of starts to mess up with like our relationship with ourselves, and relationship is the true currency when we're sort of not aligned with ourselves. The alignment with your work, the alignment with your relationships in the world also um, suffer. So today I have a person that just is an expert in how we can get some of the tools to manage this. So please help me welcome Carrie. Hi, Carrie, how are you?
Hi, my name is Carrie Cole. I'm a licensed mental health clinician, and I work in private practice in Seattle. Yeah.
Nice to meet you. Thank you, Carrie, for taking the time to speak with us.
Yes.
Yeah. Can you tell us a little bit about like how'd you get into this? What kind of work do you do, and what kind of people do you enjoy working with?
Yes. So, I work with young adults specifically in their 20s, so about 22 years old till 30. Um, and I always say nobody ages out working with me. You can just that's when people start working with me. But I have clients
Mhm.
who are into their 30s, um, and yeah. So I work with this population because when I was in my 20s, I really struggled just being in my 20s. Um, and I had a hard time finding a therapist who understood that struggle specifically. I was graduating college in 2008 during the recession and really struggling to just start life in the way that I was told to expect to. And older people weren't understanding that. And
Yeah.
I found that there's really a need to have therapists who are really curious towards what it's like for people coming into the world in their situation. Not that it'll be the same as mine, but getting curious towards how things are changing for them. And just what your 20s are like specifically. So that's what I do and why I'm passionate about it. And I find it to be really fulfilling and a lot of fun.
Yeah, and you're right. This is such a transition phase because you're, now becoming an adult and operating like an adult in the
Mhm.
world. So I know you work with a variety of clients, but given that most of my people are women, I think my question is more geared towards in that young adult age group when you work with women who are, coming out of colleges, coming out of schools, trying to look for professional careers or trying to get into grad school. What are some of the common challenges that you see that seem to be unique to women?
Yeah, and most of my clients are women, about 2/3. Um, and yes, I really I see a wide range of different kinds of issues facing women. Um, but especially with those type A high achieving kinds of personalities, I see women coming into the workforce and kind of settling into the workforce after grad school, after college, and having a really hard time adjusting to relationships after having been able to be so high achieving in everything else in life, right? Like they can go through school and getting into like a really great job, going through Ivy League schools and getting into working at Amazon or Google or whatever it is. And then all of a sudden they're done with jumping through those hoops for the foreseeable like they're going to continue their
Mm-hmm.
career, but now they really want to see how they can apply that kind of effort towards relationships and building family, and it's not the same skill set. And they have a hard time navigating that different kind of skill. um,
Mm-hmm.
and it's hard.
Yeah, yeah. And why do you see that is? Because it seems like it's sort of like a pattern of whatever I do, I'm good at, right? So it's kind of like a little bit of a shocker for the person too that there is a thing I'm not good at. Are there some common reasons why there's that?
Well, to me, like relationships are the opposite skill compared to going to school and getting a high achieving job. Like this is ambiguous, it's messy, it's uncertain, it's vulnerable. There's no clear cut way of going about doing it. Um, you can't study, you can't
Yeah.
just do the work. Like it's
Right.
much more messy, and I mean, it's different. It can feel really weird and uncomfortable and just wrong if you're
Yeah.
used to doing it, if you're used to achieving in this other kind of way.
Right. So it sounds like it's almost you have to figure out how to connect with somebody else's emotions. But do you often see that um, these kind of people also struggle with connecting with their own emotions?
Yes, I mean, if you're high achieving, you don't really have time to slow down and connect with your emotions in a deep way. You're going, right? Like there isn't that kind of pause and self-reflection that's really uh it's not given a it's not there's not space for that. And it's not really
Right.
beneficial to slow down and reflect um if there's work to be done. Hmm.
Right, right. Yeah. Yeah, you're right. It's exactly opposite. You're either you have to ignore everything, including your own emotional needs or experiences, to kind of chase your goal. So it's something that you haven't done. And do you see that impacting like what other areas of life? Because I see this commonly in my practice where women will be very successful, high achieving, very driven, and have a lot of sexual pain.
Hmm.
That's sort of my expertise, and that's why I see them. But I see a lot of overlap in what you're saying and what I see. So
Hmm.
do you often see that this emotional struggle of not being able to connect with yourself translates in any kind of sexual pain or sexual dysfunction?
Yes, it's interesting, since I've met you and worked with you, it's something that I look for now more. Um, I don't think that it's something that people bring up um,
Mm-hmm.
as readily. Obviously, it's a vulnerable thing to talk about, but I definitely do see indicators of that. That like you've said before, we hold all of our anxiety in our vulva, and so what does that um what does that look like in therapy? People hold their anxiety in their body in general.
Mm-hmm. Mm-hmm.
So if you're having like perfectionism, if you're having this like high achieving kind of life, it's tense. It's uh there isn't a time for relaxing, and you wouldn't notice that you're not relaxing because the tension
Mm-hmm.
is necessary and rewarded.
Yeah, yeah. You're so on point that it is rewarded. And this is a conversation I sometimes have with patients. It's confusing because you being this driven and this stressed out or wound up, for lack of a better word, gets rewarded by
Mhm.
high grades, high salaries, high promotions. So for your nervous system, it's like, this is a good thing. Why would I give it up? Because I get rewarded. Everybody thinks I'm a good girl when I do
Yeah,
that, right? So
and you wouldn't get
what
there.
yeah, and you're exactly right. That's what they say, that this is how I got where I am at, and I like where I'm at. You know, so with that, like, do you often see people struggling with this concept of good girl? Like, where does this fit into all of this?
Yes, especially with sexual health, like, a lot of my clients, like I said, are young in their 20s. A lot of clients that I get are 26. That's, like, the age, and I get a lot of women clients who aren't very experienced with relationships in general, and sometimes not very experienced with sex, and
Mm,
so, it is partially because of that, like, being trying to be a good girl, fearing sex, fearing having too many partners, or uh, fearing dating, sometimes because of safety, sometimes because of feeling uncomfortable, being vulnerable. Um, Sometimes they've just been too busy for like they're going to school, maybe traveling, doing these high achieving activities, um, and sex feels like the inverse relationship to that, like it's
Yeah.
not compatible in the same way. So
Right.
a lot
Right.
of times I'll get people in their mid 20s, late 20s who don't have very much experience, and then they have a fear, and it's hard to navigate for them.
Right, right. Like and there's no rule book for all of these things. So, they're just so used to going back to the rule book and figuring it out that it becomes challenging. It sounds like vulnerability might be a game changer for people who are struggling to create that connection. So do you have any advice on, like, because it's so hard being vulnerable is, I think it's become like a buzzword, and yet it is so hard to do it in real life. So do you have any advice on, young women who are struggling with that, where they're excelling in one part of their life and just really struggling with intimacy slash sexual pain?
Yeah, this is a tough one. I mean, there's so much there, right?
Yeah, yeah,
But I think the first thing, and the high achieving women are not going to want to hear this because it's about slowing down, and
yeah.
stopping, and actually starting with yourself. Starting with practicing vulnerability internally. So letting yourself see yourself more fully, and that's vulnerable. To be honest with yourself of saying like I'm struggling with this, and that's inevitably going to trigger shame.
Mm-hmm,
uh, and then that's something that you can work with is like sitting with that shame, like observing that shame, using mindfulness to observe that shame. um, yeah, this is something that Brene Brown, the shame researcher Brene Brown and author, she talks about this a lot of,
mm-hmm,
um, and one of her questions I really use quite a bit is, um, what role am I playing in this situation? So
mm-hmm.
like asking like, what am I doing in this situation to be triggering this dynamic? And that's a vulnerable question to ask. It's really getting real with
Yeah,
yourself, seeing what you're doing that's triggering this, and then that's going to trigger shame. But the shame isn't a problem when you can learn how to work with that shame to process it. Then you don't have to be scared of it. And then
yeah.
that's when we can go deeper in a relationship with yourself, and that's really what we want to practice in relationship with other people.
Right. And so it seems like this being vulnerable is going to lead to shame because you're kind of actually seeing the situation for what it is and your limitations in it. Do you ever see that creating a feeling of guilt? Because I feel like the number one emotion most of my patients feel is guilt. Like they feel guilty 4 times a day for nothing. Like
Mhm.
everything's their fault. Do you ever see guilt coming up in all of this?
Yeah, it's in close relationship to shame.
Mm,
And this is another thing from Brene Brown. It's hard not to talk about Brene Brown when we're talking about shame, but she
yeah.
really, her research differentiates guilt from shame. Guilt being I did something bad, shame being I am bad.
Mm-hmm.
And that's an important differentiator. But guilt, I find a lot of times is kind of the first thing that comes up, and it's like self-protective. If you can guilt yourself into staying busy, you can keep going and maintain that high achieving and use that almost like as a distraction. And that
Ah,
will stop you from feeling shame.
right. Oh, so staying busy is sort of like a coping strategy at this point.
Oh, yeah. Oh, yeah.
Okay. Okay. Yeah, it's adding up so many things because when people feel stressed out, they just feel like, I just need a plan. So it's essentially, I just need to get more busy so I don't have to feel stressed.
Yeah. And then then it's hard to stop because you'll feel guilty.
Right. Right. It's like a loop. So does this ever get better? Because I understand that you can work with this, you can learn how to sit with your shame and all of that. So is there like a stopping point where you no longer have those emotional responses, or is this something that you just keep working through your life? Like, do people, I guess, get fixed. Is my I don't know if I'm phrasing it correctly.
It does get better. It just doesn't get better the way that people are hoping or expecting, and it doesn't get better at the pace that they're expecting to. So it tends to function more like a spiraling process of getting better, or maybe not even as neat as a spiral. It's messy,
Mhm.
right? Like
Mhm.
kind of like two steps forward, one step back all the time. So you might be able to practice some healing and letting go of that guilt in one situation and then process the shame underneath it and feel like you've made real progress, and you have. And then a month later something happens that really triggers you in a bigger way, and that guilt comes back up and you find yourself in the same pattern over again. And then that can be really anxiety provoking because it's like, I already did this. And especially for the high achievers out there, they're used to doing a task and completing it and moving forward. Whereas this is different. This is going to be like you do something and then you have to do the same thing in a million more ways, slightly differently each time, to really hone that skill.
Yeah. Yeah. It's sort of very similar to like pelvic floor injuries that I see, right? Like the same trigger. Sometimes there is an infection. Sometimes the trigger is like stress at work or relationship stress will create the same pelvic floor tension. And, patients often feel frustrated as to, well, is this my life now? I already did it. And I'm like, yes, you did. But this time, either it's going to take a lot for the pelvic floor to react that way, or it's going to resolve faster because you have already done the work. But it seems like it all comes down to nervous system, right? Like it's not the muscle that's getting tight; it's your nervous system that's kind of giving you that alarm.
Mhm.
So I think it's good to hear for all of my people out there, and thank you for saying it, that it's much messy, and everything else in life we are used to put in the work. This is done, move on. But this is more like go back and start a little bit ahead of where you were last time. But yeah, it's messy and it's spirally.
Yeah. But I
uh,
think it is important to note, like, that with the nervous system, even when you did that progress initially, you did train your nervous system in that moment. And it's like a workout.
yeah,
You did get exercise, and you worked out your nervous system to be calmer in that moment. And then the next time when it feels like it's regressing, it's not fully regressing to the where it was before. You
right.
still have some memory inside of you of that.
Yeah, and it's not, the work is never wasted. You're just laying down groundwork, and you just gotta keep going till your building's tall enough. So it's never really a waste of time or effort, from where healing perspective. So I know there's just so much we can talk about each of these, right? Vulnerability itself, like but if you were to sort of think of one thing, like a lot of my patients, including myself, we're just constantly grappling with this value system of productivity that you need to get shit done, and also like being vulnerable and connecting with yourself. It just seems like two opposite ends. So for people that are grappling with these two exact opposite things and want both of them, what is the one thing that comes to mind that they should be doing, or one thing that they should be avoiding, that sort of fosters a better relationship with themselves?
Yeah, I think the biggest thing is self-compassion. That's like the goal that we're always working towards. And so when you're feeling that harsh voice in your head that is driving you towards perfection, try to speak back to it in a kinder way. Try to speak to yourself in a kinder way. Trying to give yourself patience and grace is so important.
Yeah. And are there any quick and easy ways to practice that on a daily basis? Like what's like a 1 minute thing you can do to practice compassion with yourself daily?
Well, I think the biggest thing is a meditation practice.
Mm-hmm.
So you could start with 1 minute for a meditation practice. That's something, and work up to a meditation sit, or practicing meditation just daily when you're washing the dishes. Practicing being present opens up some space for self compassion. That's the most powerful way, I think, to get there.
Yeah, yeah. And it's so hard because I do that 1 minute every day in the morning. And the only way to do it is not turning the Wi-Fi on my any of my devices. Because we're just like so now trained to react to a notification
Mhm.
that I just the only I don't even turn Wi-Fi on until I'm ready to like, but it's so hard because there's such FOMO.
Yeah, I get it.
But thank you, Carrie. This was super helpful. So if people who are listening in want to reach out to you or talk to you or work with you, where can they find you?
Yes, my website is probably the best place. It's carriecolecounseling.com, and
And
yeah.
yeah, and are you taking new people?
At the moment, I'm pretty full.
Mm-hmm.
Just FYI, January is a hard time to find a therapist. It's always when we get full really fast. But
Yeah.
I usually have spots opening within a couple months. So
Awesome. Awesome. All right. Well, thanks again, Carrie. I hope you guys enjoyed some of the things we talked about. If you're like me, this is going to be a life work of how to, be perfect, but not let it get into other aspects of your life in a negative way, right? So I will catch you next time. You know where to find me. Thank you, Carrie. Have a wonderful rest of the day. See you,
yes,
everyone. Bye bye.